Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Public Health District, Julie Pryde. Thanks for joining me today, Julie.
Sure. Thanks for having me.
I was really hoping that Champaign County would start trending in an opposite direction of how we were last week, but we're still continuing to see cases increase, are we not?
We are exactly one case away from our highest point ever, which was back way earlier in the year. And yeah, we're right back up there, and it's not showing any signs of going in the opposite direction. It's actually getting worse.
What I wanted to ask you about was schools reopening, because it makes me really nervous that they're expecting teachers and bus drivers and cafeteria workers to go back into schools. Are we being short-sighted by saying, yeah, we'll have some sort of in-person schools in a month, or are we expecting for the best?
Well, I mean, there's certainly a lot of planning going on. And again, the data is going to have a lot to do with how this happens, how schools open, if schools open, if they have to stagger open. There's all kinds of things that are needing to be looked at. Right now, what we were talking about earlier, right now in, this late in June, we have 177 active cases. We have 12 currently hospitalized and 18 deaths. And like you said, we're going in the opposite direction. But I wanted to show some kind of things that what we're talking about here as far as the kids, because I don't think people understand that, yes, kids do get this. We have right now, as you know, 1,280 confirmed cases in Champaign County. Of those, 19% are kids under 18. We have everything from infants all the way up to 18-year-olds. So this is, that's a pretty good chunk. Almost 20% of all of our cases are in young children, and that is higher than the state average. So, it's something that we really need to be thinking about and having options for people who can't go back into the schools, whether they're teachers or whether they are students or whether they're students that live in homes with high-risk people. So there really have to be options out there for people. The safest way is definitely virtual learning. But I don't have to operationalize this guidance. We just have to say what the guidance is. And because schools have a lot of other things that they're looking into that public health isn't necessarily looking into. So right now, I know it's only a month away before a lot of things are planned to open, but honestly, the way the numbers are going, I don't even know what we might see right then. Right now we have, the hospitals are one of our big metrics, and the hospitals are filling up. They're filling up with things other than COVID as well, but it doesn't matter. A hospital bed is a hospital bed, ICU bed is an ICU bed, etc. And we have, 12 currently hospitalized from Champaign County with COVID. That's what I think is getting lost on a lot of people. I keep saying this over and over, but our hospital has a large catchment area. It's not just Champaign-Urbana, it's not just Champaign County, it's about 1.5 million people. So other places that aren't doing things properly are also adding to this. So, as our numbers keep going up, it's possible that the governor will say no to something. It might be that regions will fall back so far that we'll say we can't do this in this way at this time. So, it's good that everybody's planning, and the schools certainly have to be planning, but plans have to be flexible, and they have to include the potential for, if not starting with in-person online learning, then at least moving to it at some point, because that's certainly a possibility.
New CDC guidelines say that schools should reopen, but we're now seeing more cases emerge from young people. Are they considered, quote, super spreaders, and are kids having long-term effects of the virus? Do we know these things about how kids are spreading it and what's happening when they do get the virus?
We don't. I mean, first of all, the quote unquote new CDC guidance is a politicized guidance. I am mortified, basically, that the CDC has put out something that is suspect. You certainly don't expect that from the Centers for Disease Control, but reports and things are changing despite the guidance that is being put out there personally by the people working in this. So the guidance from the CDC originally was what Illinois is working on, and certainly what Champaign County is working on. So there is no big push there should not be any big push to get all kids back into schools, especially when you look around the country at some of these hot spots. It's beyond irresponsible, and people will absolutely die from it. When you look at Florida and Texas and Arizona and different places like that, and they're talking about putting kids into schools, that's going to be a disaster. And I hope that they can get it stopped. Locally, we keep a really good eye on our stats and everything, and we will be using those to provide guidance to our schools moving forward. But this belief that kids don't get this and don't spread it is just false. I mean, they most certainly do get it. They most certainly do spread it, and they certainly can die from it and have died from it. They also have had really serious health consequences from it. And again, we don't know what this virus could be doing long term, and we also don't know what could be, so we don't know what damage it's doing, and we don't know what it could be doing long term. It's a brand new virus. It's nothing to mess with. And I still cannot wrap my head around the fact that we have almost 150,000 deaths in this country due to this virus, and still people are wanting to argue about, ridiculousness of wearing a mask and simple things like that. And one thing that concerns me, I will tell you, is there was like a demonstration in Springfield this weekend of parents who don't want their kids to wear masks to school. So what are you going to do in schools when you have this type of situation? Because there will be, kids who will not be following guidance, or parents who are fighting with the school so that their kids don't have to fight guidance or follow guidance. So, that kind of thing is concerning. But, we're working with the schools. We're trying to review their plans for them that they have put together. They've put it together based on both the ISB guidance, Illinois State Board of Education guidance, and then what CUPHD put out later. So, as my main goal is for plans to have options so that people can, if we have a lot fewer kids in the schools, to be able to do adequate distancing and make sure that the teachers and the other at-risk staff are not around them, and that kids who are at risk or kids who have family members who are at risk have an option of staying home as well.
I am listening to medical experts and, of course, public health officials, and the consensus among your departments and medical experts is that we need to reset and shut things down, whether
Yes.
it is 2 weeks, whether it's 90% of everything except for essential services. Do you think that should happen, and do you think that ever would happen here in Champaign?
Well, it certainly could happen here in Champaign. Again, or Illinois, again, in general, it has to do with the numbers. But there are absolutely, if not early on, if the country had done this, well, I can't even get into that. It could have been done differently, but let's just start with where we are now. The states that are seeing exponential growth of cases absolutely need to shut down immediately. They should have shut down quite a while ago. And if they don't do that, they're just going to see the cases and the deaths continue to shoot through the roof. And I don't know how that's acceptable, but apparently in some places that is being allowed to happen.
All right, let's talk about the group of people that are congregating shoulder to shoulder in a place that is a proven spreader, and that's the bars. We have U of I students coming back in a month. We still have the bars open in Illinois. We have them across the country, and that appears the 20 to 29 group that's spreading the virus right now. Do we need to close bars?
If we don't close bars, we knew as soon as they reopened them that there were going to be a problem. And if we do not set some guidelines for bars that require basically people to stay seated when they go to bars, if they want to go out and drink, just like you do at a restaurant where you're sitting at smaller tables with the smaller groups of people, Yeah, there at some point we'll probably need to do that. We have some bars that are following the guidance really well, some that are not following it at all. And unfortunately, what that's going to end up doing is continuing to um, shoot our cases up. I actually printed out a little thing for this. Oh, look at me with a little graphic here. Oh, look at that. I've never done that before. But I want you to see here, this is, this is our big age range. You can see that the older people are, basically taking care of themselves. But this group right in here, are continuing to party and go out and go out to bars. Bars, we get complaints all the time. And just so the bars are aware, which they are because the cities have told them and the liquor commissioners, if they're not following the state, local, and federal laws, that can put their liquor license in jeopardy. And certainly, I know, in Champaign-Urbana, that information has gone out from the liquor commissioners, which are the mayors, to let bars know that they need to be doing this. And public health is going to have people out there from midnight to 2 wandering around, finding out who is not following this guidance, and it will be reported, and they are going to take action. This kind of stuff has to stop. And if the businesses aren't going to keep track and take care of their patrons themselves, like a lot of the bars are doing, then those who aren't doing it are going to have consequences for it. We cannot let this continue. It will end up shutting down all kinds of businesses. Certainly bars would be the first to go, but other ones as well. So we can't just keep letting the cases go up and up and up without making some changes. So as far as I'm concerned, the whole bar thing opening was a mistake because it's happening exactly. It can happen. It can happen safer, but it isn't in most places because the bar owners aren't bothering to follow the guidance. We have some that do a really good job, and then they're going to end up, basically being punished, if you will, if the bars have to shut down again. So we've got that, and everybody is really concerned, about the U of I students coming back, but you really need to take a look around because it's our own community doing the spreading right now. There's no U of I students here to blame, or very, very few. So, our community is continuing to have big parties and events and hanging out in bars and doing stuff that they have to know is not safe to do during a pandemic, and yet it continues. So, there are going to be consequences, whether they are infections and leading to, deaths or other negative consequences, or having to shut things back down.
Let's say somebody goes to a bar and then we get them to contact trace. Let's say we make them immediately get a test. The tests are not to find out. I mean, they are. I've been tested twice to see if I have the virus, but isn't it more for data keeping? What is the ultimate purpose for testing?
Okay, that's a really good question. So what the point of testing is not for you just to go out and say, oh, I ran around the bar this weekend, I wonder if I'm positive. We still want you to go out and test if you've been running around, but the point of the testing is it's a public health tool. The entire point of testing for this virus that we can't do anything about once you have it, as far as giving you some type of drug to prevent you from getting a worse case, for example. So the point of it is that so public health, we know who's positive so that we can then try to find out where they've been and who they've been around, put that person in isolation, put the other people in quarantine, and then stop the spread from just continuing to move outward and getting more and more people infected. This kids and the younger people going to bars, they're spreading it to people who are more vulnerable. And there are some people who are more vulnerable themselves who are going out. I cannot stress enough that one of the factors, one of the underlying health conditions that people don't accept, I guess, as an underlying health condition, but it's obesity. And there are a very high number of very negative consequences, whether it's in kids, teens, adults, or older people. Obesity and all the allied comorbidities that you may not even know you have with it, it's leading to more negative outcomes. So it's important that we start taking this seriously again. It's like when we moved to phase 4, a lot of people just started acting like the pandemic's over. The pandemic is so far from over. We could be in a much better place than we are now, but we're not. And what really concerns me, Champaign County, because of all of our access to testing here, we are light years away from a lot of places in Illinois. And so other places, once it starts getting in there, it's going to be invisible, a lot more invisible than it is here. We see what's happening, and again, that's a public health tool, and that's helpful. But Illinois is almost light years ahead of other states. So not a lot of other states. So we're just seeing it all over the place. We're getting ready to see, well, we are seeing through, remember how horrified we all were of New York when you saw the people in the hospitals and they were exhausted and people were having to come up from all over and people were dying and they were bringing in morgue trucks. Well, we have right now 3 New Yorks going on right now. We have 3 states that are basically where New York was, and more are on the way.
There are restaurants now, because a lot of them have 50% capacity, McDonald's, Chipotle, that are now requiring face masks. I say it's a couple months too late, but isn't this the perfect chance for you, Julie Pryde, administrator of the Champaign-Public Public Health District, to tell people, if you're going to go inside anywhere, doesn't it just make sense? Put on a mask, whether it's for 5 minutes to pick up food or 10 minutes to eat a quick bite.
Yeah, absolutely. The putting on of the mask is literally the very least people can do. And it is super important. The countries, I just posted something this weekend because, we're up to about 150,000 deaths in Hong Kong. Guess how many Hong Kong had throughout this pandemic? 18 deaths. Hong Kong is about the size of New York, and they had 18 deaths. We're up to 150,000, and we're on an exponential growth curve. So it is just going to keep going, and keep getting bigger and bigger. So we are our own worst enemies, and we are just doing the worst job in this pandemic. And this pandemic is the big one. This is the big one that public health always talks about. And we can have more than one big one. And in fact, if this is how we're going to respond to pandemics in this country, we will have more big ones. Because in the past, we've just been able to prevent a lot of things, but this is just completely getting out of control.
This is a perfect segue, and I don't mean to pick on our neighbors to the north, but this past weekend, part of Champaign County, Rantoul, had a big truck event, and there were vendors, and there were people packed in with families, kids, older people. I'm not doing anything in public. You're not going to major events. Why are we still holding major events?
Well, that's a good question. It's not a good idea. There are ways to do things safely, and you can make it look like you can do things safely on paper. But the fact is, what we're finding is that as things, they can look safe on paper, but when people get there, they're not following guidance, not following rules, not staying away from people. There are choke points at things like bathrooms and food vendors and any type of display of something, and it's not safe. And I don't know why they are continuing to hold events, and they're doing them all over the place, not just in Champaign County. We need to stop pressuring places to do things like this and just accept the fact that we're in a pandemic and that we need to all change our behavior to get through it.
And you get the final word. Back in March, you started saying that this is a marathon, this is not a sprint. Here we are almost to August. What would you like your final message to people to be in this segment?
Well, I really need people to understand that this is not the time that we should, be acting like this pandemic's over. It's so not over. We're so nowhere near that. And I feel like our county, we have a lot of people just fighting every single day to do the right thing and to make sure that our community is safe. And then we have things going on as well right alongside of it that are causing super spreader events or causing outbreaks. And I keep saying this, I had hoped that we would have a lull. Our cases were going down. We are one case away from the highest we've ever been right now. School's not in, the U of I's not back. There's no reason for it except for people are just acting like it's, last year and we're not in a pandemic. So I'm worried, and we've kept the death toll down in our county, which it's still 18, is 18 more than I had hoped to have, but that's going to increase as well. We're still in summer. People can be outside a lot. We're getting ready to move into winter, and rather than having our cases down here, we're right back up here, headed up this way, with no slowing in sight. So I'm disappointed, frankly, and I think that, and it's got to be frustrating for people too who are doing the right thing. And I was at the farmers market this weekend, and I even posted about this. If our country was being run right now like the Urbana farmers market, we'd be done with COVID. There was not one person without a mask. There was not one person getting into other people's space. People were respectful. Everything was clearly marked. It was outside. And, so that's a perfect example of something that can be done safely. It's an outdoor event. It's done just perfectly. But it takes both time and planning, and it takes people paying attention and watching it, and it takes respectful patrons of whatever event to make sure that they are doing what they need to do. And unfortunately, we're just not there. So we're seeing more cases, and it very much worries me what we're going to see this fall and winter. It really does.
A lot of the credit of what you talked about goes to Urbana Mayor Diane Marlin for the farmers market, to the response, all the way down. She sets the tone. Thank you, Mayor Marlin, for letting us do these updates. I think Julie and I want to have a group thank you to our editor today, Jason Liggett, who is going to have his work cut out for him. But thank you for everything you do every week. And of course, Julie Pryde, administrator of the Champaign-Urbana Public Health District. This community is so lucky to have you. Thank you for everything you do.
Thank you.